Before making some concluding comments, I just wanted to mention to everyone that it's been brought to our attention in the afternoon that we overlooked one of our members who died in this past year, a 28th member, and that was Reba de Tournier. Reba was many years the Dean of Nursing at the University of Washington, a wonderful leader in the field. She edited the Journal of Nursing Education, and she died just in September. And so I just wanted to mention that so that we could remember her as well in the course of this day. What a day, an extraordinary day, a stimulating day, a vital day, a challenging day. We began thinking together with the help of Mark Rosenberg, our keynoter, about violence as a public health problem. And during the course of the day, we've been searching for just the right metaphor. Is violence like the tobacco problem? Can we see a way to deal with it with strong opposition? Is violence like the automobile situation, where we recognized we had a lot of injury, but then we found ways to deal with it that included education, but really focused also on the automobile and focused on safe highways? Is violence like an infection that we can catch near or far, and how it spread, and how should we think about that? We're trying repeatedly throughout the day to come to grips with how do we gain purchase on such a complicated, such a challenging, such an overwhelming problem. And it's hard to imagine any problem that bears so heavily on the health and well-being of individuals, families, and communities, where the gap between the scale of the problem and our willingness and degree of commitment of resources is so wide. This stands out. It cries out for us to come together, for us to think about what can we do, how can we act as individuals, as a community, to do more to undermine, mitigate, and prevent the problem of violence. We also heard so clearly through this day that violence is not a single problem. Perhaps the multiple metaphors are symbolic and emblematic of the fact that many different dimensions of violence call for different levels and types of research and different specific focused interventions. We heard about ways that biological science holds some promise, but is so far so limited in its predictive ability. We heard about very concrete interventions in the community where the concentration of violence can be identified that are proving they work. We've heard about interventions with prevention of family violence. But we also have to deal with the whole scope of the problem by understanding its parts and being able to think clearly about what types of preventive interventions make sense for what types of violence, and how can we most effectively organize the combination of research and learning that's going to be necessary for us to come forward with ever more effective, ever more successful interventions. Finally, do we have, as a nation, the will to face up to this problem? The evidence thus far, as everyone has averred, would have to be no. The one aspect of today's discussion that I think we've not really quite come to grips with as yet was brought up initially in Mark's third point this morning on forming effective coalitions across lines that you would not expect that coalitions could be built. We have a very challenging set of questions about when is it appropriate to be the opposition and when is it appropriate to be the partner. With whom can we work successfully to focus on the problem of reducing violence, and what interests are inimical to that success that have to be opposed? This is going to take judgment, it's going to take discipline, it's going to take a lot of dialogue, and it's going to take a willingness on the part of the entire medical and health communities to play our part. We know we cannot do it without bridging widely with the disciplines as represented in the course of this day, from basic biological science to criminal justice. But we also know that health professionals have a special opportunity and a special level of esteem in the community that give us an opportunity to be the leaders that will make the difference. I hope you will all join me in expressing our deep appreciation to every one of our speakers in the course of this day. Thank you all so very much. I'd like again to acknowledge particularly Nancy Adler, not only for her role in the planning committee, but for her moderating and leading throughout the day of the program. Thank you so much, Nancy. Also, the other members of that program committee, Stephen Hyman, Arthur Kellerman, Judy Salerno, and Lauren Schern, thank you very much. You know that this program, like every one of our membership programs, depends on the leadership and effective engagement of our membership office. I can't imagine a better group with whom to work, and I'd like to specifically recognize each of them who is here, and particularly first, Judith Shamir, our Director of Membership Services. And Judith, I see you. Please stand up. Donna Duncan. Donna, where are you? Probably doing more work to enable us to have our refreshments. Is Zamika here? Zamika Stewart? And Jamal Samuel? They're all working. Thank you, Judith, for having them work so hard on our behalf. I'd like to also express on a personal level my thanks to my own staff who, believe it or not, get me through this kind of a program with seeming ease, but actually sometimes I feel like it's more that I'm on Being John Malkovich, if you remember that movie where you open your mouth but you're channeling the guidance and advice from this wonderful group. Morgan Heller in particular, I want to thank you, Morgan, through the day. Raynell Bradshaw, who helped prepare all of the background materials, and Sherla Allen, my personal assistant, who helped me so much. Thank you all so very, very much. And finally, I do want to express all of our appreciation to the IOM staff who volunteer to do the extra work required to help us find our way through the day, manage to be at the right places at the right time, and have everything available to us and for us when we need it. They include, especially, Catherine Bothner, Abby Meltzer, Martin Cavani, Corin Merritt, Claire Flanagan, Nicole Joy, Daniel Bethia, many other volunteers, and most particularly our acting Leonard D. Schaefer Executive Officer, Clyde Bainey. Thank you, Clyde. And now I have the special privilege of drawing to a close the 12th annual meeting, which I've had the privilege over which to preside. It has been a daily joy to serve as the president of the Institute of Medicine. It's true, I cannot imagine having had a more rewarding experience, thanks to all of you. Thank you very much, and enjoy the reception.